So my research topic is on cervical musculature resistance training to prevent sport-related concussions in female soccer athletes. I focus my research mainly on high school and college athletes. The concept of neck strengthening for preventing concussions is still fairly new and there isn't much research on it currently. However, the conversation of concussions in sport is still growing. So I know for myself, I've heard of neck strengthening programs being implemented for soccer teams, so I wanted to take a look at the research behind it and see if it's an effective tool. So here are some prevalence rates on sport-related concussion. 5 to 22% of all high school and college soccer injuries each year are concussions. In female sports, soccer has one of the highest rates of concussions next to basketball. And women and youth are at the greatest risk for sport-related concussions. Women are also found to have weaker neck strength than men. Female soccer athletes specifically have a 2.4 times greater risk for concussions than male soccer athletes. Some major factors of sport-related concussions that I've come across are whiplash, transferal of forces through the neck to other parts of the body, head-neck acceleration, neck flexor to extensor strength ratio, and neck strength and girth. Very few studies have investigated the relationship of neck girth on reducing the risk of concussions. However, there's a correlation between neck girth and linear and rotational head acceleration during impact. So if neck girth is increased, there should also be a decrease in head acceleration, which would aid in concussion prevention. Heading the ball and whiplash type motions are the most common cause of concussions in girls and women. Some other mechanisms include contact with the ground, another player, or the goalpost. As heading is an important part of gameplay in soccer, it means a higher risk of sustaining concussions for these athletes. One study that I read determined that there is a disconnect between the amount of ATs who believe that neck strengthening is beneficial and the amount that are actually implementing it into their practice. They found that almost 70% of ATs that were interviewed believe that strengthening the cervical spine helps prevent concussions. However, less than a fifth of them had actually implemented it into the training for their women's soccer team. So this study was conducted this year, so it just tells us that as ATs, there is an issue here that needs to be investigated a little bit more. The literature that I have come across says that decreased neck strength is a risk factor for concussions, as it is not as effective at withstanding velocity during head impact. Therefore, it increases the severity of the impact. Weaker neck strength can cause greater acceleration of the head, which is a major factor of sustaining concussions, as it is a quick acceleration and deceleration of the head that causes the brain to collide with the inside of the skull. The literature also states that a muscle imbalance between the cervical flexors and extensors is correlated with increased acceleration on impact. The SEM, upper fibers of traps, and deep cervical flexors are important muscles to train in strengthening programs as they generate force and torque, provide neck stabilization, and are able to anticipate and prepare for impact. As these are the most important muscles for decreasing concussion risk, all of the research included resisted flexion and extension, and in addition, some also included side bending and or rotation. One other study also included dumbbell shrugs. For volume and intensity, the studies I looked at used between 1 and 3 sets and 6 to 12 reps of the resistance exercises. And they increased either every 1 to 2 weeks or after they had adapted to the exercise. So here are some limitations in the research that I've come across so far. One of them being a lack of research on neck strengthening for preventing sport-related concussions in general. And there's even less when looking at soccer athletes and more specifically females. With this comes very small sample sizes. So 2 studies that I looked at only included 2 female athletes. One had 9 and one had 26. Another limitation is that some studies used an external force applicator, which in one study consisted of a helmet attached to either 2 TheraBands or virtual reality goggles. The external force applicator makes it difficult to reproduce this method and therefore the results in a real-life scenario. Another way of providing resistance was done manually by either a teammate or a strength and conditioning coach. So this method is more recreatable, but there's a margin of error as it's a little bit difficult to get the correct amount of force to be applied for every set and rep and to increase it over the duration of the program. So my recommendations for a cervical strengthening program include 8-week training periods or longer, generally completed 2 times per week, as 4 to 7-week programs did not find significant changes in hypertrophy. We also have to remember when strengthening the neck flexors and extensors to strengthen them equally because of the chances of increased acceleration if there is an imbalance. Generally, the neck extensors are stronger, so test beforehand and be aware of this when training. It's also important to work on the deep cervical flexors in addition to the superficial muscles, as it can decrease acceleration. The combination of both resistance training and proprioceptive training shows a better effect than just resistance training alone. Proprioceptive programs show hypertrophy in both motor control muscles as well as force-producing muscles. From the literature, I've also found that there needs to be a focus on SCM strengthening because of its ability to do linear and rotational head movements. So this means that there can't be exercises done only in the sagittal plane, as this wouldn't be realistic to the multiple angles that a head impact can come from. Progressive weighted flexion, extension, side bending, and rotation of the cervical spine is the most beneficial combination in strengthening programs for female soccer athletes. So in conclusion, I believe that a cervical strengthening program would be beneficial when preventing the risk for concussions in female soccer athletes, as there are minimal risks and it can increase neck strength and control head acceleration and velocity, which are factors that aid in reducing the risk of concussions. So they can easily be added to an existing general strength program or as a warm-up for female soccer teams.